First of all, I mean, the congressional briefing is an annual event that's vitally important to our sector because so much of our business, as well as our livelihood and the livelihood of our patients, are dependent on congressional action or, unfortunately, sometimes inaction. So we're here at least once a year, and so oftentimes more often, to make our case on a number of issues with respect to adequate funding for Medicare and Medicaid, with respect to resetting the table, so to speak, if we can, on reasonable regulations that are adequately paid for, and also to make our case on how significant improvements we've made in quality care over the last several years.
Now, you mentioned regulations. The requirements of participation are on everybody's mind. Can you tell us how your business is adapting and what you would like to maybe see changed or tweaked on this?
Well, it's a challenge. I mean, we don't want to come out against regulation or against improvement in regulation. The requirements of participation were so massive and so costly, and some of it so redundant, and some of it also so driven more or less by paperwork as opposed to actual improvement of delivery and time to deliver care, that it's really taken a lot of time away from our existing staff at a time when staffing itself is a big challenge to comply with paperwork as opposed to actually delivering the care. And so a lot of the requirements of participation we found are very costly to implement and are counterproductive to our mission, which is to maximize the hands-on care that we're paid to deliver, we're expected to deliver.
You mentioned staffing. Can you talk about the challenges and maybe what you're doing to keep and attract staff at this time with such a good economy?
Yeah, I mean, staffing has always been a challenge, even when it's a bad economy, getting quality staff and keeping people. But now more than ever, as the economy improves, the employment pool has shrunk considerably. People have other options. We also have many states implementing significantly higher minimum wages, $15, which has had a cascading effect upwards to require greater and higher payments in order to retain staff at a time when we're not being reimbursed for it at all. We have tried so many creative measures at a significant price tag, such as giving bonuses to employees who might bring in other employees even if they don't stay permanently. We are paying sometimes not just regular overtime but double overtime for those who might work a 7th shift or more in the course of a week. Our mission is to make sure that we're adequately staffed, even though the challenges to do so are increasingly difficult, and it's a big challenge. We're also not sure, quite honestly, how some of the changes in immigration may affect us, because a lot of our employees are often, at least in the major urban areas, new immigrants, and we want to be sure that they're adequately trained and that their presence is assured for the longer term rather than the short.